we're just going at it. And then the radio show itself will actually air on Saturday morning at 9 a.m. As part of our Saturday morning lineup of podcasters
Okay.
and radio shows. Ready? All right. Good morning, Flagler County. This is Danielle Anderson, your host of Lifeline, the radio show connecting you to positivity in our community. And we have Dr. Arnaldo in the studio this morning. Good morning.
Good morning, Daniel.
So I'm going to make you say your last name because we're practicing, but I'm not quite good at it yet.
My name is Arnaldo Trabuco.
Trabuco. And you were telling us some really cool, interesting facts here. You're a new doctor here in Advent Health.
Yes, I am.
And what is your specialty?
I practice urology and urogynecology.
Okay.
I've been at it for now 40 years, and I've been a pioneer in my area. I first started practice in New York, and in New York I had 3 different offices, one in Manhattan, 2 in Queens, and I was on staff at 7 different institutions over there.
Wow.
And over there, it's a different life than here in Palm Coast. You do have traffic there. Here they don't.
You must be looking at social media with our traffic.
Enjoying the traffic here, but my background basically started as a pioneer in ambulatory surgery. Me and my father were the first to perform operative interventions on a patient in a doctor's office, which at that time was unheard of. At that time, I was also trained in inguinal hernia repair. My father's a herniologist, and we both wrote the textbook of hernia at that time, chapter 5. Make a long story short, because of our experience in hernia surgery and our experience in being able to anesthetize the appropriate nerves, we would be able to do operative interventions, whether it was a hydrocolectomy or a varicocelectomy, different operations. We'd anesthetize the nerve on the patient. The patient would be awake. We had a closed-circuit TV monitor where the patient would watch his own operation, while simultaneously the family was in another exam room watching it on a TV monitor, speaking to the husband and the wife at the same time. And we'd be making jokes and just to bring some levity to the patient and get his mind off of it. And the patients would be really enthralled about watching their own operation. They'd bring VHS tapes at that time, taping their own operation.
Wow.
And bringing it home and then going and have parties with their friends showing, look, this is what the doctor did for me.
How unusual. I mean, I've never heard of anyone doing that.
As we pioneered that, at that time, Blue Cross Blue Shield never heard of anything like that. They didn't believe that we can do an operative intervention in a doctor's office. So they came down, and these were all suits, and they came into the office. There were about 5 of them at the time. They watched us do the operation, watched the patient speaking to their family, getting up off the operating room table, and walking home and going home. At that time, an inguinal hernia or something, you'd be admitted into the hospital for 1 night. You'd have the operation the next day, and you'd be in the hospital for about 5 days afterwards for pain control, which is the wrong thing to do because pain management is best when you ambulate immediately. Make a long story short, these patients would get up off the operating room table and get off, go home in their car, and then go home.
And recover at home.
And recover at home in their own comfort of their own home. The suits at that time, they saw this, and they then deemed that ambulatory surgery is the way to go for the future, and that no patient could be admitted into the hospital for a hernia surgery anymore. So at that time, we had a plethora of doctors coming to our office from all over the country, teaching them different techniques for anesthetizing nerves to be able to do the operative intervention under local anesthesia, whether it was a hernia, whether it was a varicocelectomy, whether it was a hydrocolectomy, et cetera. And we had gained notoriety. I was in New York. I must have set up about 20 ambulatory surgery centers there. And after a period of time, I was then recruited over to the Midwest to do the same. And then from there, they wanted me over in Nevada. I did the same in Nevada, Arizona, Italy, and then came back to the States, Florida. Did the same over in California, which I just came back from for being over there for 5 years, and now I'm here in Palm Coast, Florida, permanently. I'm not going anywhere.
Well, I'm just like, how did we get you to come here?
Palm Coast is paradise, as far as I'm concerned. The people here are the nicest I've ever met, and the area is absolutely gorgeous. My wife is from California. She grew up in a small town that had a population of 3,000. And she came over here. She's been mesmerized on a daily basis just from all the greenery that we have and the people, and she loves it here.
I hear that from people who come from California. They're surprised by all of our trees.
Yeah, yeah. You don't have the same vegetation as you do have.
It's incredible. And so for you, I mean, it's a big change to come from the places you've been to be in a place like this and it's smaller. Do you like that?
I love it. I love it. I lived in Florida for 5 years back in around 2015. But I always loved Florida. That's why I'm back.
That's amazing. I mean, we've been, so when you're getting and navigating the Advent Health system, is there anything about it that's different, or is it all kind of similar?
Advent Health, it's a growing medical industry, and there are things that I do that have not been done here ever. So there are procedures. For example, there's a procedure that I do called axonics neuromodulation, where patients that have a condition called interstitial cystitis, they're in chronic pain for eternity. They've seen over 20 doctors. They're on a boatload of different medications with no relief. And they're chronically depressed. Some of them are suicidal. And they come basically with the hope basically to get some kind of relief. I do a procedure called axonics neuromodulation, which is basically placing a tiny little electrode into the nerve that innervates that area of the body. And I give them their life back, get them off all the medications. They're back to normal everyday activities. Most of these patients, they haven't had sex for 20, 30 years. And now they're like animals going back into the wild. Bottom line
really
is
good.
they have an amazing response, and they're off all their medications, and they're no longer suicidal, and off out their antidepressants.
So when you see that transformation with a patient, how does it make you feel?
That's why I went into medicine. That gift, that empathy that I get, where the patients get amelioration of their pain or their condition, that to me is the biggest gift of all. It beats any kind of monetary issues. When you're changing a patient's life for the better and putting them in the right direction, you can't ask for anything more.
That's like the true foundation of why you get into medicine.
That's why I went in, and we've been doctors in our family since the 1400s in Italy. At that time, a doctor was a doctor. All right, you didn't have urologists, you didn't have cardiologists, you didn't have surgeons. A doctor came in with his black bag, and if the patient had an appendicitis, he'd come in with 2 bags. All right, one was the bag with his utensils, and the other bag was a bag with a lot of the sheets that he would bring. So the patient would be put on the kitchen table. My great-great-grandfather would have his bag with the ether and whatnot, and he would take the sheets and pin them to the ceiling so that the paint wouldn't chip off during the operative intervention into the wound. He'd do the anesthetic, do the appendectomy, close them up, and then the wife and my great-grandfather would take the patient and then bring him to his own bed to recuperate as the wife was cooking the meal for after the operation, where they would sit down and have a meal.
Wow.
And that's how we would get paid most of the time, with either chicken, eggs, or a meal.
Do you have like the history of your family going back to those days?
Yes, I do.
What's that like when you're able to look at that and see how medicine's progressed?
It's amazing to see what they did at that time without the tools and the CAT scans and everything that we have. I have to say one thing. I trained in Italy because I kept the tradition from all my ancestors. The diagnostic capability in Italy is, I think, far superior than in America in general, because they don't rely on CAT scans, MRIs, as we do here. They go by physical palpation and physical diagnosis. And they come up with the diagnosis correctly and treat the patient appropriately.
Is it a difference in training?
Yes, it is. My training is different. I did a hybrid type of approach. I did basic sciences at NYU Medical School as I was going for my PhD in anatomy. And I flew to Italy at the end of the year to do the courses that I needed for my MD for the first 3 years. And then the last 3 years, I finished over in Italy. I stayed there completely. The MD program in Italy is 6 years long, as opposed to a 4-year program here in the United States. So you're given a different type of scenario. Here in the United States, you're given a multiple choice with the answer in front of you. All right, and you have to pick A, B, C, D, or whatever. In Italy, you're given the textbook of anatomy, Gray's Anatomy. The index is photocopied for you, and they say, learn it and come back. So when you come back for your exam, let's say they have a panel of professors. One is from the skeletal system, vascular system, neurological system, organs, etc. And that table is about 15 professors long. And you go from one station to the next. And they'll ask you one specific question. For example, what is the origin, insertion, nerve supply, arterial supply of the sartorius muscle, and what is its function? So you have to spit it out verbatim. Just one line out of Gray's Anatomy textbook. So it's a different type of scenario as far as the education is concerned. You literally learn the textbooks. Sometimes the Italians will take 2 to 3 years before they have enough courage to sit down for the exam because it's that voluminous as far as the volume of information that they have. And it's a different type of grading system. You can pass or you can fail. And if you fail, you have to come back when you know the information completely.
It's kind of like doing vocabulary words over and over and over until you get it.
Yeah, exactly.
But you never forget those things.
Repetition is the key to success.
That's amazing. All right, so we're going to take a quick break, and we're going to talk about what you're doing nowadays,
Okay.
and some of your favorite things to work on. We'll be right back.
Right.
That is awesome. All right, ready?
Yep.
All right. So we are back talking urology and urogynecology, and so when we're talking about these kinds of procedures, what are some of the things that do you have a preference on, like a favorite procedure?
I specialize also in female urogynecology, pelvic reconstruction. I think that's probably one of my most rewarding procedures because patients will come in with urgency, frequency, stress incontinence, chronic constipation, sometimes in pain, and they're on multiple medications to try to alleviate. When I bring them in the operating room theater and I do my pelvic reconstruction, I basically cure them of all their ailments. So their frequency, their incontinence, their problems with constipation are all resolved, and any pain that they may have.
So are there things that women can do preventatively?
Well, if you've had children, Kegel exercises is the best preventive medicine as far as that's concerned. Additionally, when you get older, the ability to produce the hormones that are necessary for the vaginal vault to maintain its proper milieu are reduced. So some people are put on oral medications, but I find that the vaginal topical estrogens are the best. In fact, the Food and Drug Administration just the other day came out with the statement that the use of vaginal estrogen creams are found to be very helpful for women, and there is no medical problems as far as cancers are concerned in the future, which has been plagued in this industry for a long time. And I'm grateful that that article came out.
I think, did they have a news conference on it? A press
They did.
conference?
They
I thought
did.
I saw
And
that.
the FDA has taken it off their black box warning.
So as women, I mean, we kind of think that, okay, so once we get to a certain age, we aren't having sex anymore, and these things have to happen to us. And that's just the way it is. But that really is not the case.
A lot of people don't have sex because of vaginal dryness, itching, pain, what we call dyspareunia, or if it's their counterpart, the male, I also deal with the male counterpart. So if they have erectile dysfunction, we fix that, whether it's by medications or by penile implants, inflatable or non-inflatable. So whatever's broke I fix.
You can do that here in Palm Coast.
I do that here in Palm Coast, yes, for women and for men.
I didn't realize you did men as well.
Yes.
So what are some of the common things that you would work on for a man?
Men, prostate cancer is very prevalent. Since I've been here, I've been picking up a tremendous number of prostate cancers. And we approach it in different ways, either by a radical retropubic prostatectomy, which is removal of the prostate, the seminal vesicles, and the surrounding lymph nodes. And or if the prostate cancer is confined and the patient is not a good surgical candidate, we either debulk the prostate with a laser prostatectomy. We have a special laser called a green light, where if the patient is having obstructive voiding symptoms and the prostate is very big, putting that patient through radiation therapy sometimes is not going to be very effective. So we debulk it and we get down to as far down to the capsule as possible where the cancer is, so that this way the patient can pee afterwards and they don't have the obstructive voiding symptoms. Then after a period of 6 to 8 weeks, they recuperate from the surgery. They undergo radiation therapy, and the need for neoadjuvant treatment with other medications or chemotherapy is markedly reduced.
So if someone does have prostate cancer and you've been able to detect there's a little bit outside of where you thought it was, would you recommend that they would go and get radiation?
Yes. But depending on the volume of the disease, the volume of the gland, the effectiveness of the therapy is going to be dependent on that amount. So debulking it has been a way to go. And a lot of different procedures are used for that. I prefer to do what's called a green light laser enucleation of the prostate, which is a laser that we vaporize the prostate. And it's a bloodless procedure, so there's no blood loss associated with it. And the patient goes home the same day.
You are really big on going home the same day, huh?
Yeah, yes. Yeah, my entire practice is based on trying to discern what is the best treatment for this patient, what is going to be the most efficacious treatment, where the patient will have the least amount of discomfort and be able to return back to work or whatever they do for a living.
So when we're talking about outcomes with prostate cancer and treatment, how successful are those?
Depends on how soon you catch it. And this is where the big problem is. The doctors that I've seen throughout the country tend not to get their fingers dirty. So digital rectal exams, for some reason, has gone to the wayside. And for any of you listeners that are listening to me, if you're going to come to me, expect to have a rectal exam. That's the only way that you can really pick up these cancers. 20% of the patients that have prostate cancer can have a normal PSA, and if you don't do a rectal exam on the patient, you can miss that. Picking it up early can save that patient a whole lifetime of misery. And if you can pick it up early, you can cure the patient. If you pick it up late, then you have to contend with either chemotherapy or additional neoadjuvant treatments in order to get that patient either out of pain or paralysis or cachectic and being able to function in society normally.
And ongoing maintenance.
Yeah. The ongoing maintenance for some of these treatments is cumbersome for some of the patients. If the patient has come to me for, let's say, stage D disease, prostate cancer, and it's spread to the bones, these patients are in unremitting pain, and you need to get them out of the pain. So combination of medications to get them out of the pain immediately. I just had a patient, for example, he came, he was admitted to Advent Health. He had paralysis and extreme pain in the bones. And I put him on a medication. Within 48 hours, he was moving his legs, and he was out of pain.
It's incredible. So are you the only urologist that we have here? I know we were
No,
thinking.
I have a partner, Dr. Highshore, and there's a Dr. Torchy as well.
So the three of you kind of work together.
Three of us work together, and we're part of Advent Health. There are other private urologists that come here sporadically.
So have you been able to bring anything new to the community that they didn't know about before?
Yes, I have. Urogynecology was not done here before. And with my knowledge of pelvic reconstruction and whatnot, this is a brand new aspect for Advent Health. So basically we're getting a urogynecology division, and we have just gotten another urogynecologist on board, so this way we'll be able to contend with all of your female problems that you have out there.
I was going to say, like, you're going to be in high demand, I think.
Well, we're always in high demand, either male or female. But besides the female urogynecology, there are other procedures I do. For example, axonics neuromodulation. Patients that are wearing catheters for the rest of their lives, they don't have the ability to contract the bladder. And when I do this axonics neuromodulation, we put a electrode into the nerve that innervates the bladder to stimulate the bladder to contract. So if the patient has an obstruction with the prostate, we would do the prostate operation first with a green light, and then we would do the axonics neuromodulation and have the patient be able to pee for the first time in their life in decades. Wow. So it's a life-changing thing for the patients, especially when they've had a catheter for like 10 years.
Do you ever see us going to like lab-grown organs that will replace damaged organs or things like that?
I see stem cell therapy as a very, very important modality for the future. And it's still in its infantile stage, but I see that as a treatment for some of the women with stress incontinence, males that have had operative interventions for stress incontinence, and also for regeneration of certain tissues, and various other specialties as well. You know, things, for example, diabetics. This is a modality that is now being done where there's a medication that's being used to suppress the patient's immune response in type 1 diabetic. My wife is a type 1 diabetic, and she's going to be undergoing this. Basically, you suppress the immune system, and then you take the pancreatic cells that have been grown from stem cells, and then you inject that into the vein, the artery that goes to the liver. So new islet cells form that produce insulin, and the patient is off insulin.
Are you excited to see that
I
happen
am
for
very
her?
excited.
I bet she is too.
Yes, she is.
That's amazing. Okay, we have two minutes left. All right, tell us a little bit about, do you have a favorite hobby?
I love kayaking. I love bike riding. I love sailing. And I love everything that has to do with the water, basically. Bike riding is probably one of my favorite hobbies that I do right now.
Very cool. Anything you're looking forward to in Palm Coast or you'd like to do while you're here? And then
When the weather gets a little bit warmer, I'd like to do play some tennis that I've been used to in the past.
have you tried pickleball yet?
I have not.
Oh.
No.
Yeah, you come to the right community then. That's great. So how can folks get in touch with you if they'd like to schedule an appointment?
Well, they can call my office. It's 386-586-1705 and ask to be seen by Dr. Trabucco. That's my first name is Arnaldo, so it's Arnaldo Trabucco. Full name is Arnaldo Francesco Trabucco. But you
Can they call you Dr. T if they have to?
Yes, exactly. Most of the patients can't pronounce my name, so they call me Dr. T.
I love it. So thank you for coming. I know you're super busy, and I really do appreciate you being here.
Thank you for inviting me.
Yeah, and we're glad to have you in our community.
Thank you. I'm glad to be here.
So we do want to thank Flagler News Weekly, WNZF News Radio, the Vigilante Philanthropists, Massage by Natalie and Company, and also our local Benjamin Moore Paint store.